Hi, Assalamualaikum and good morning. My name is Harith, and today I want to talk to you about the drug's name Gentamicin. Okay, as you all can see in the slide, this is Gentamicin. How it will like. Okay, next. Okay, for this topic, there is four content. First is uses, second is side effect. Okay, third is dosage, and fourth is precaution. Okay, today I will talk to you about all this content. Okay, let's proceed. First is uses. Okay, gentamicin is an antibiotic and to treat several bacterial infection. Okay, how this drug works? It works by stopping the growth of bacteria in your body. And this drug is prevent wide variety of bacterial infection. Okay, as example is bone infection. Bone infection means that there is infection in your bone. Okay, then pneumonia, it means that you have infection in your lung. And then urinary tract infections mean that you have infection in your urinary tract like kidney, bladder. And then is sepsis. Sepsis means that you have infection at your blood vessel. Okay, based on cases from the hospital, 62% to 98% patient with infection are cured with this gentamicin treatment. Okay, next is how this drug is administered. It is given by intravenously, means that it injects directly into the vein, which is your blood vessel. And secondly, by intramuscular, mean that it inject deep into the muscle. Okay, why we give it in these two ways, IV and IM? Because this drug, if you give it orally, means that you eat the drug, it will not absorb at the intestine. So there is no function at all if you eat that drug. Okay, next. Okay, this is how we inject. This is intramuscular, mean that you inject deep into the muscle, and this diagram is inject into the vein. This intravenous. Okay, next. Okay, this is side effect of the drug. First is vomiting, stomach upset, loss of appetite, inject site reaction. As you all can see here, this red one. This is the side effect of this drug. Don't worry, it is common, and it will a little pain, irritation, and also redness like this. Next is nausea. Okay, nausea, and then vision problem and joint pain. This is common side effect. Okay, next. Now I will talk about the dosage of the drug. Okay, basically this drug you need prescription from doctor and pharmacist. You cannot take it by yourself because you're afraid that maybe you can get overdose. Okay, firstly for adults, you need to get 3 to 5 mg per kg per day by IV or IM, and it is every 8 hours. And then for children and adolescent, this is for 5 years old and older, you need to give them 2 to 2.5 mg per kg per day by IV or IM every 8 hours. And then lastly for infant, this for under 5-year-old, you need to give them 2.5 mg per kg per day, also by IV or IM every 8 hours also. Okay, next. Now I want to talk about the precaution and warning. Firstly, if the patient have dementia, means that memory loss, and they take antipsychotic drugs, we cannot prescribe this drug to them because the increase of risk to death is high, so we don't give to them. And then if you overdose the drug, you need to contact poison medical center immediately. Okay, next is you need to keep away this drug from children. You cannot store it above 25 Celsius, and the drug is should under dose clinical observation, means that doctor should give the dose for your drugs. And then all patients should have kidney function test before starting gentamicin. Why? Because if the patient have renal impairment, means that you cannot use a kidney, the doctor will need to lower the drug. So if you don't tell them, doctor will don't know and give you the drug that overdose. Okay, next. If you're pregnant or lactating, okay, you only can use this drug if it is no other safer drug, because this is dangerous for pregnant women and only if it's life threatening. And then why gentamicin also can go to the breast milk and pass to the infant, so it is dangerous to the mother and also to the infant. Okay, that's all for me. Thank you. Assalamualaikum warahmatullahi and happy Ramadan.